we treat the condition? Well, we treat it neurologically. We use brain-based therapy, or we treat the brain. How do you treat the brain? Well, we're going to use concentrated oxygen. Oxygen heals. If you have parts of the brain that are damaged and we run our tests and figure out what parts are damaged, we can treat those parts of the brain with concentrated oxygen. Proper glucose. Your body needs proper fuel. If you don't give it the right kind of fuel, it's not going to work right. Okay? Activation. Your brain needs activation. It needs stimulation. If parts of your brain, like the lower brainstem, aren't working, and we need it to work better, we need to activate it. We use things like spinal decompression, laser therapy, adjunctive therapies, physical therapies, things of that nature to wake up or treat or activate parts of the brain that aren't functioning. Sometimes we even use interactive metronome to get the brain working from left to right properly. It's kind of like your car engine. There's a right and a left side to your brain, just like there's a right and a left cylinders in your car. If the 4 cylinders on the right are going down the road at 3,000 RPMs and the 4 on the left at 1,200, your car ain't going to work. Well, if the right side of your brain is going 3,000 and the left 1,200, your body ain't going to work. Okay? We have to treat it that way. Ask yourself the 4 following questions. Okay? Number 1, how has your chronic balance, vertigo, and dizziness affected your job, your relationships, your family, your time, your happiness? What does it cost you in terms of money or time or sleep or worry or stress? What does it cost you? Number 3, where do you picture yourself in 1 to 3 years if this condition keeps getting worse because you're not taking care of it or your doctor's not fixing it? Where do you see yourself? And number 4, what is it worth to you if someone could actually rid you of that problem? Is it worth your time? Is it worth your effort? Is it worth doing things the doctor asks you to do? If you can't answer those 4 questions, then don't call me. We can't help you. Okay? If you're serious about this, and if you're serious about finally getting over this condition, give us a call, 271-6992. If you're not serious, if you don't want to put in the time, if you don't want to do what the doctor asked you to do, if you're not willing to have the proper tests run, keep taking your pills. Keep getting worse. That's fine. We treated out of this clinic last year 18,203 patients. I simply don't have time to accept every patient that walks through my doors. So if you're not a candidate for my program, then keep taking your pills. Stay on that path. But if you're a good candidate, if you come in and we run our 4 screening tests on you and it says you're a wonderful candidate, we literally can change your life. Visit our website, www.thechronicpainclinic.com, and you can listen to some of our other patients that have suffered from this condition that we have helped change their life. You can read what they had to say. You can listen to them on video. You can actually read about them in this book, the book I wrote. Their stories are in here as well. If you call our office and make an appointment, we'll also send you a free DVD. This DVD that you watch will tell you exactly why and how and what we need to do about treating your chronic balance dizziness and vertigo problem. It'll give you some insight on what to ask me when you come in. If you have old blood work that your doctor's taken, bring it with you. If you have old MRIs or old x-rays, bring them with you. I need to see them. It'll help me determine your success rate for treatment, which we want to have at 100%, or we simply won't accept you as a patient. Again, visit our website, www.thechronicpainclinic.com. Call our office, 271-6992. If you're ready to change your life, if you're ready to end your condition, give me a call. I'm Dr. Jeff Smith. I look forward to seeing you in the future. Have a blessed day.
How many years did you have the problem?
I'd say 25 or more.
25 or more. Was it something that you had tried other things and treatments and medications and other things for with
Yes.
doctors?
Yes.
It's probably some degree of success, but it always hung around,
Right.
that type of thing? Okay.
I had lots of bursitis problems in
Yeah.
my elbows and so forth, and the shots for that did not work.
None of that worked? Okay. You also had fatigue issues, sleeping issues. That's
Yes.
pretty typical with fibromyalgia patients that we see. So we examined you and determined you were a good candidate for our fibromyalgia program for brain-based therapy. We put you through the program. You're actually getting re-examined today. Things are going really well.
They are.
Okay. What have you experienced as a good benefit, I guess, from going through our program so far?
I don't have hardly any pain at all anymore in my muscles.
You don't ache when you get up, that kind of
No.
thing? Sleeping better?
I feel more rested when I wake up.
Are you able to do things outside of the home before you go without having to think about them before you do them?
Yes.
A lot of patients that have fibro, that's the main thing. They gotta plan out their day ahead of time because they,
Oh, yes.
you know, if not, when you reach that limit, when you've gone too much, you have that fibro fog and you
Exactly.
crash. So you're able to do that now. Great. Well, we're getting ready to.
If you're sick of having pain and sick of living on pain pills, you can come see Jeff Smith at Smith Chiropractic Clinic. I called him up and made an appointment. Jeff took a couple of x-rays of me and studied my case. It was the most professional operation I'd ever seen. The place is wonderful, and I can't say enough good things about it. I don't know what I'd do without it.
We will design a wellness plan that's right for you. Call us today for an appointment.